Can everybody hear me okay? All right, excellent. I'm going to share my screen. See if I can pull this off. All right, let's see. Screen sharing, let's do a slideshow. Can everybody see the slideshow? All right, okay, so thank you for the lovely introduction. My name is Dr. Nita Chen. I'm part of Newport Neurology Associates. So I'm a neurologist who specializes in movement disorders, so in particular Parkinson's disease. So today I'm going to talk a little bit about brain health and general lifestyle changes that can really help the aging population. So it's not just particular to Parkinson's disease, just in general as well. All right. Okay, so let's start with food, everyone's favorite thing. Okay, so let's talk a little bit about the nutrition overview. And so when we talk about nutrition, we think about macronutrients and micronutrients. And so macronutrients is what we're familiar with, the calories, right? So your proteins, your carbs, and your fats. And so these are the things that you consume that provides energy for our body to function. Those are really important, and those are the things we tend to think about on a large scale. Then we have micronutrients, and so they don't really help you with the energy level, but they're really important for your overall health with building vitamins and helping with the metabolism. So minerals and vitamins are a big part of that. So your vitamin D, your vitamin B, and so they're essential, but they're not really contributing to the calorie aspect of it to give you fuel and energy. There are other things, other food components that are also important for health. So dietary fiber and phytonutrients, and these things kind of help make the machine run smoother, right? So it helps with your bowel movements, helps with various aspects of your health. So that's kind of how I approach nutrition in like 3 big categories. And so well, the way that I look at nutrition is fuel for your body, right? And so you have to put gas in your car for it to run. And same thing for our bodies, that you need to put nutrition or good nutrition into your body so it can function to the best that it can. And so if you're not getting adequate nutrition and not feeding yourself well, hitting all the categories, then your car is not going to function very well, right? So if you use suboptimal gasoline, then you're not going to get a great running car. It's the same idea that if you're not having good and well-balanced nutrition, that's going to affect your ability to perform well and feel well. And so in general, what we found in specifically for Parkinson's disease, but overall for the aging population, the Mediterranean diet has been shown to be pretty good for our overall health. It's plant-based foods and focus on fats, lots of vegetables, lots of fruits, beans, nuts, and whole grains. We do like to encourage a good amount of fish because they have a lot of high omega-3. We want to be cautious about having too much fish because some fishes can contain high levels of mercury, and that's a toxin that we don't want in our bodies. We don't want a lot of red meat, but we do want a good amount of it because it gives you a lot of energy. And we don't really want to focus too much on the processed sugars and sweets and processed foods. So if you look at the pyramid on the right, I don't know if you guys can see my cursor. You see the top of the pyramid. So the top of the pyramid are the things that you should have the least amount of. And then the bottom of the pyramid should be the majority of your diet. So you see meats and sweets, they should be the smallest amount. You should have them, but not all the time. And then eggs, cheese, and yogurt, and poultry, so chicken. These are moderate amounts. Fish and seafood take a bigger amount. And all of these, the top 3 tiers, of your pyramid give you a good amount of healthy fats and protein. And these are all really important for energy and feeling well and feeling cognitively kind of intact, right? So a lot of us feel like when we don't eat enough protein or fats, our thinking kind of slows down. We kind of get that brain fog. And so we want to make sure we have a good balance of that. And fruits and vegetables, olive oil is also great. And then this is kind of the invisible part of that bottom of that pyramid, which is really important, that we want to be physically active and maintain a lot of socialization as well. And that is really important in part of getting the nutrition to work the best that they can. All right. Okay, so good pros and cons of Mediterranean diet. So the benefits, there's a lot of benefits, right? A lot of good fiber, good high omega-3. It's really great for reducing risk of heart disease and stroke. helps with blood sugar. So if you have history of diabetes, that can be really helpful. And we do think there's a lot of studies that are coming out that we think that the Mediterranean diet kind of slows any issues with cognitive decline. So things like dementia or Alzheimer's or memory issues. It can also reduce the risk or delay of developing Parkinson's disease. Is something that we're studying. Jury's still out, but there's a lot of good data. We're looking for that. There are some cons to the Mediterranean diet because it has so much healthy fats and we're reducing the amount of protein. We're not focusing a lot on red meat. You can have some weight loss that comes with it. In general, after the COVID pandemic, I think most of us would appreciate a little weight loss. But as we become more elderly, and especially in our Parkinson patients, having too much weight loss can be very dangerous. It can cause us to be at higher risk of falls and injury. And so we want to make sure that we're not losing too much weight if we're doing the Mediterranean diet. It does require more meal preparation. So the fast foods and Carl's Jr. or McDonald's are not part of your Mediterranean diet. So you do have to be more thoughtful about what you're eating and consuming. So this take more time. Some of the foods that we eat, like the fish, chicken and grains, they can be a little problematic if you have issues with swallowing. And we do see that in our Parkinson patients where swallowing solids or big chunk of solids or dry foods can be challenging. And so that can make it difficult to consume these foods. Oops. All right. Okay. And so there are other types of diets. And so the ketogenic diet is another one that is pretty popular that we hear a lot about. And the ketogenic diet focuses a lot of fat and not a lot of protein and carbohydrates. Not a lot of great evidence for my Parkinson patients or whether or not it works well or not. But it is another one that's out there focusing a lot on healthy fats. Okay. And the pros and cons. And so the ketogenic diet has been helpful with weight loss. It helps with blood sugar management because you're not focusing a lot on carbs. You're using mostly fats to provide the nutrition. It does help with some seizures for people who have a history of epilepsy. And there's been thoughts it could kind of slow down the aging process, but a lot of this has been on animal studies and like mice and monkeys. So not really shown to be proven in humans yet. There's some studies that think that maybe a ketogenic diet can slow down some of the other issues in Parkinson's disease, like the memory issues, dizziness, other autonomic sleep disturbances, things like that. But not very well studied yet, not a lot of data. The con for ketogenic diet is it can make you really tired at first, and because it also focuses a lot on the high fat, it's very easy for you to become deficient in other nutrients. So that micronutrient aspect that we were talking about with the vitamins, minerals, that can be very easy to displace. And so if you're on the ketogenic diet, you want to be very careful and cautious about supplementing any vitamins that you're not getting. You can get a lot of weight loss. And that can be good or bad, like before we talked about. So it's another thing you want to watch out for. Because it's very high in fat and very low in carbohydrates, most of our carbohydrates come in the form of sugars and breads, and also in a lot of vegetables. The low fiber can cause a lot of constipation. And you do have to be very careful to track what you're eating because you can break out of the ketogenic diet very easily. So this is another one that takes a lot of time. Okay. All right, there are other diets out there. So there's the Mind diet, and that one is like a modified version of the Mediterranean diet. There's gluten-free diets and dairy-free diets, and all of these are kind of more like fads, in my opinion. Not a lot of great data. There's possibility of it being helpful, but how much does it help? We really don't know yet. And so a lot of the things we want to look at with nutrition in our Parkinson patients is we want to make sure the body weight is still good. We don't want to lose too much weight. We don't want to gain too much weight. We want to make sure we're not having malnutrition. And so malnutrition is when we're not hitting all the macronutrients and not hitting all the micronutrients. And so the micronutrients are the ones that we often forget about, having our vitamin Bs, your vitamin Ds, all of those are so important in making sure that we feel well. If they're low or deficient, it can make us tired, more fatigued. Our memory thinking can slow down. And sometimes we can even get nerve damage where we get numbness and tingling in some areas of our body if the vitamins are low. We also want to make sure the medications that we take doesn't interfere with the food that we're eating, because there can be some interactions. And so we want to be very cautious about the timing of it. And so there's a lot of studies that have come out that, protein, when you eat protein with your Parkinson medications, it can interfere with the absorption. And so if you're eating it at the same time, your Parkinson medications will be less effective if you're eating a lot of protein. And so most of the time we recommend for our patients to take, the medications 30 minutes before they're going to consume that protein, to help the medication to be absorbed as effective as it can be. That's not to say to not eat protein, because protein is really important in building muscle and it's a very important macronutrient, but the timing of it matters. The other thing that happens in Parkinson's disease is we have a lot of gut dysfunction. So when I think of Parkinson's disease, I think about things slowing down. And so the body slows down, movement slows down, and that's the same with our gut. So the gut starts to slow down, which means that we're more likely to have constipation and difficulty absorbing all the nutrients. So you could be eating all the right food, but maybe your body, your gut is not absorbing all of it. And so that's something that we have to be aware of and be on top of, because we don't want to have more problems with constipation, and then that can cause a lot of issues. Okay. All right. And so this is kind of a general graph. It's a lot, but in general, what we see, so if we look at the bottom line, this is kind of our lifespan in the Parkinson patient, and we look at our body weight when over time. And what we see is early on in the Parkinson's disease, the weight is pretty stable. But then what happens over time is that you start to lose some body weight because we're not moving as well, we're stiffer, we're not exercising as much, we may not want to eat as much because we're worried about our swallowing. We may have more anxiety and depression, and that can change our appetite. When we start to get the diagnosis and then start treating a lot of our symptoms, we usually see patients gain that weight back and they start to do a little bit better. And then over time, what we worry about is if we're not controlling a lot of the symptoms, we're not seeing our doctors regularly, we start to lose that weight again because we aren't controlling our symptoms, and we start to have more issues with our movements. We start to have more tremors, more stiffness, and all of that can cause more pain. And that also uses more energy too, right? So you're burning more calories if you're having a lot of tremors and moving a lot. And if you're not eating a lot to catch up with it, that can cause you to lose a lot of weight. And so what we want is we want to prevent this decline downwards in body weight, because we know that when we start to lose a lot of weight like this, then it really affects our lifespan and our quality of life. Okay. And so this is one of the really startling statistics that I have found over time, is that malnutrition is present in 24% of patients with Parkinson's disease. And so that's a pretty big number. It sounds like something that we should really be addressing, but nutrition is something that we don't really talk that much with our patients, and not all of our patients talk to a nutritionalist, and not all nutritionists are familiar with Parkinson's disease. So, and that's a pretty scary thing. And 60% that they found are at risk of having malnutrition. So we're not always very aware of the things that we eat, right? And so this is something that we really need to address and be cognizant of. And one of the reasons we find that malnutrition is a big risk for Parkinson patients, because it's hard to get more calories and more proteins for many reasons. A lot of it is that increased energy expenditure. So when we start to have a lot of that slowness, stiffness, and tremor, all of that uses calories. If it's so much harder for you to move, you're going to use more calories to try to get moving. So you're burning more calories in that sense. We start to have more issues with swallowing. So dysphagia is difficulty with swallowing or eating, feeling that things are choking or stuck in your throat. And so if that happens, it may decrease your appetite and you may not want to eat as much. It also changes the kind of food you're eating. You may not be eating as much protein because a lot of the meats are harder to chew and they're tougher and to swallow. Gastroparesis is a slowing of the gut. And so if your gut is slow, you're having constipation, that really reduces your appetite because you're not able to move your bowels well. And that can make you feel very unwell. And in general, decreased appetite comes together with the changes in sense of smell and taste. So a lot of our Parkinson patients lose their sense of smell even many years before their Parkinson's disease. And when we lose that sense of smell, we know smell is really intimately tied with taste. So your sense of taste can really change. A lot of my Parkinson patients will tell me that, after they've been diagnosed, they've noticed that they prefer really salty, very sweet, very savory foods because they don't taste things as well. And they're starting to rely more on the spices and increasing the salt, which may not be a great idea if we have high blood pressure or heart conditions. And that can affect what you're eating. And finally, the food-drug interaction is a big part. Knowing that protein can affect the absorption of our medications, a lot of my patients get very anxious and worried about eating protein because they worry that it's going to interfere with the absorption. And so rather than timing it and separating it, a lot of my patients stop eating the protein for some time. And that's not great because you start to lose your macronutrient calorie, and that can cause a lot of weight loss. All right. And so constipation is a big part in Parkinson's disease. And we talked a little bit about that gut kind of slows down, but there's also a lot of aspects about constipation that happens in our Parkinson patients. So a lot of times as we get older, we don't drink as much water. A lot of it's because we just don't feel thirsty. And what happens is as we get older, that drive to drink water, to feel thirsty, it starts to go away. And so by the time you feel thirsty, you're already very dehydrated. So we found that, as we get older, the thirst drive, the thirsty feeling is not a good marker of how well hydrated or how dehydrated you are. And so most of the time we find that patients are not drinking enough water throughout the day. On average, it's about 6 to 8 glasses of water a day, which might seem like a lot, especially during the hot summer months. If you're exercising, you need to increase that amount because you're using more water as you're sweating. Fiber is a big part that plays in constipation. Fiber is hard to chew. And so if we're favoring softer foods, then we might not be getting the fiber we need that's really important in helping with that constipation. Okay. And we also, I'm so sorry. We also know that when we exercise and move more, that when we move, our guts start to move a little bit better too. And so a lot of times that our patients, if they're, lying in bed a lot or sitting down a lot and they're not moving a lot, then their gut really slows down and the constipation gets a lot worse. And so if you're stiff and you're tremoring and it's hard to move around, you're not going to feel motivated to exercise. And then that will slow you down and the gut will slow down and you start to get a lot more constipation. Okay, and so lots of ways to manage constipation. And so we want to make sure our dietary fiber is about 25 to 30 grams a day. Most people eat half of that amount. And we also want to drink more water, about 8 cups of water a day. Now we can mix that water so you can eat a lot of your water. There's a lot of foods that are high in water content. So if you don't like the taste of water or it's difficult to remember to drink that many, you can supplement it with high water foods like watermelon or fruits, or certain vegetables have a lot of water in them. Other things, if we're trying these dietary changes, it's not really helping that much. We're trying to exercise more. There are medications that can be very helpful in managing constipation. And so there's all of these, some of these are over the counter, some of them are prescription strength. Kind of talk to your doctor before you start any of these to see if it's the right one. You can see that some of these, like bulk producing laxative, like Metamucil or Miralax, these are laxatives. And while they help you move your bowels, they also lose water with it. And so if we're already not drinking enough water, this can increase the risk of you becoming dehydrated. That's not to say it's not a good idea to use these agents. You just want to be mindful. If you're using them, you might want to make sure that your water intake is adequate and you have to adjust it in response. Okay, and so I also hear a lot of questions about probiotics and prebiotics and what's the difference between these things. And so prebiotics is basically extra dietary fibers. And so they are used to kind of improve the gut bacteria. So it helps your gut kind of bacteria flora be more balanced, and it helps it with gas and bloating and things like that. And so prebiotic foods, good ones are bananas, onions, garlic, artichoke, chicory root, and even beans. And so these are things to supplement if you're having a lot of that constipation, if you're having a lot of bloating or a lot of gas pain, it can be very helpful. And so we hear about prebiotics a good amount, but we hear a lot of probiotics. And so probiotics, what they are is they are actually tiny microorganisms. So they're like little bacteria. And what they do is they give more benefit to your gut. And so the prebiotics is nutrition for the little bacteria in our gut. And the probiotics are the little bacteria. You're inserting more bacteria. So if you have an imbalance of your bacteria, probiotics can be helpful to rebalance that. Okay, all right, I'm gonna skip this slide. All right, so coming to the most important part in terms of our Parkinson patients and general aging population that we don't do very well, exercise. As we become more sedentary, exercise has become more and more challenging for us. But we do find that, when it comes to our Parkinson patients, our medications don't really change the course of the disease. It doesn't slow it down. We don't have a cure for Parkinson's. But what we find over and over again is that exercise can slow down the Parkinson's disease. Patients who exercise tend to have better prognosis, they respond better to medication, and their disease is milder, which is all good things, right? And so then I get the question, what kind of exercise is any good? Right? In general, what I tell my patients is any exercise that you enjoy is really going to be the key, because what we want is regular exercise and consistency. So this is a marathon, not a sprint. We don't want you to exercise a ton and then burn out. What we find to be the most helpful exercise that helps patients do well in the long run is consistent ones that you're going to do consistently, regularly, 3 times a week, get your heart going, and it's over a long period of time. So you got to enjoy it, right? So if you're doing an exercise that you don't like, you're not going to keep up with it for a very long time, right? So we want to make sure that you're able to do that. We find that aerobic training is more important than strength training. That means more of the ones that get your heart going rather than the ones that are building muscle. The aerobic ones have been shown to be more effective. It's good to have diversity, so you can always alternate and switch it up to have a little bit of aerobic, a little bit of strength. So you're also not bored and not giving up on the exercise, because it can be a challenge to maintain at times. Gentle stretches can be very helpful for exercise for our Parkinson patients. We tend to get stiff, so it's hard to move around. So the stretches help maintain that limber movement for Parkinson's disease. It also helps reduce a lot of the muscle pain, because the muscles can get tight if you're stiff all the time. Balance training is a really good one, because as we get older, our balance isn't as good. Our reaction time is not as good. And in Parkinson patients, balance can be a big problem. And so we want to make sure that we don't lose that balance, because we don't want to fall. And that's the big killer in our Parkinson patients. We fall and we fracture our hip, and it's super hard to recover from that. So we want to make sure that we never get to that stage. And so balancing is really good. Good training. And so dancing, boxing, bicycling, all of these things are really great avenues to train your balance, to make sure you're going to be safe. And if you do fall, how to fall in a safe way so you don't hurt yourself. All right, and so safety is super important. We want you to do all these exercises as much as you can, as hard as you can, but we don't want you to hurt yourself, because that's really going to be the one thing that sets you back and then makes it hard for you to exercise, and you go kind of down the downward spiral in that sense. So we don't want that. Okay, lots of resources for exercise. I have some on here, and you can always look it up. So Dancing for Parkinson's, Rock Steady Boxing is a great one. So they're an organization all across the US who have trainers who are specialized in Parkinson's disease. It's a great program. They have gyms all over the US that you can look up. There's a lot of resources online that you can do online classes from your home, and virtually as well. And that can also build a sense of camaraderie, right? When you have a group of people who are exercising together with you, it can be really helpful. Okay, and so that kind of leads us to the social interaction. So loneliness in Parkinson's disease is a big part, and even just in the aging population, more so in chronic illnesses. And so loneliness is really bad for our health. We found that when we are lonely, we have a big increase in our heart disease risk, stroke risk, and overall mortality. So people who are lonely tend to live shorter lives and have more medical issues. And so that's not something to sneeze at, right? When we talk about loneliness, we think about loneliness in 3 different spheres. And so there's intimate sphere, the relational sphere, and the societal sphere. And for a person to not feel lonely and feel connected and overall well, all three of these spheres need to be checked off. So all of the needs in each sphere needs to be met. So let's talk about the intimate sphere. So the intimate sphere are the people we hold closest to us, the relationships we build in our home life. That can be our spouse, our partners, our children, our siblings. And that is one that can change when we start to have major illnesses or chronic illnesses of Parkinson's disease, where everything becomes about going to the doctors and going to appointments, and then your spouse becomes your primary caregiver, and you lose a lot of that close relationship as a couple in itself, and you become more isolated. And it's very common that couples can be lonely together. You're together in the same space, but you're lonely in different ways. And so the relation sphere also is really important. So this is friends of varying degrees of closeness. And so this can be a work friend, this can be a social friend, a church friend, things like that. And so we know that when we have a diversity of friends, that is really helpful for our patients, not to have friends only in one category, and can be a difficult sphere to maintain as we get older. As we retire, we lose a lot of our work friends. And as we get older, a lot of us start to have more illnesses and sickness, and then they may pass away as we get older. And so you may lose a lot of friends in that relational sphere. And that can be very challenging for our older patients of how do I make friends? When I'm home most of the time, I'm not working, right? And this is where hobbies can really come into play, and finding new hobbies, things to do with other people, joining a club or going to the community center, finding something new that you enjoy. And that can be good ways to kind of keep that up. And so exercise classes are actually great, because when you go exercise, you're joining a new relational sphere, and that can give you more diversity as well. All right, societal sphere is very similar to relational sphere, but societal sphere is more about a sense of purpose in the community. And so this can be one community or multiple community where you share similar goals, where you give a bigger sense of purpose. So we're kind of going from the center core and kind of expanding out into these spheres. So the societal sphere is a bigger one of your place in the world of being a human and living in society. And so these can include women's group, men's group, they can be churches, can be hobby groups, and there's overlap between relational spheres and societal spheres as well. And so your societal sphere are individuals you work with or you spend time with that give you a societal sense of belonging and an overall bigger sense of meaning. And all three of these are very integral in making you feel not lonely and feeling well. And so all of these things are all really important for brain health. And remember that when we talk about brain health and overall lifestyle changes, it's not the absence of neurological symptoms. So it's more about optimizing the positives, and we want to enhance our quality of life. All right, and so that is the end of our talk. And I will introduce a little bit of concepts about our department and what we do. And so I'm part of Newport Neurology Associates. Here's our information for our website and our contact information and where we're located. So if you wanted to check us out, you can go there on any of these platforms. And so our mission for Newport Neurology Associates is we're kind of looking to provide comprehensive care for our patients that is really tailored to what you need as an individual, and to change that with you over a period of time, because life changes and we want to adapt that with you. And the great thing, what we offer in our services, is we give you that accessibility, because we hear a lot from our patients that, in the community, it's really hard to reach your doctors, or when things change, it's really hard to kind of have that time to discuss your questions. When you are at the doctor's appointment, that time is so limited, and it's really hard to kind of get through all those questions. And so our goal is to really kind of giving you that extra time, that availability, to help you kind of figure out what are the best ways to live the best quality of life for you. We have a couple of different options for what we offer. I'm going to put them up here and you can read through them. And it's also available on our website. And so if you have any questions, feel free to give us a call or contact us for more information. Oops. All right. And I'm also part of a bigger group other than just the neurology aspect. So I am the movement disorders doc and the Newport Neurology Associates, but I'm also part of Newport Concierge Physicians, which is a big group of family medicine doctors and internal medicine. So we're kind of overseeing this global, general health of seeing you as a patient as a holistic whole, right? Not just a neurological issue. Okay, and so we're located in Newport Beach. And then if you have any questions regarding what we offer, we're happy to schedule an appointment with you and talk to you about what we can do. All right, so I think that's the end. Do we have any questions? Let me stop sharing.